Hello, bonjour, kumusta to all my favorite people. It's your favorite caffeinated, medicated, and never hydrated nurse, Nurse John, and we are back to your favorite podcast. I beg your pardon. How are you, bestie? How is everything going in your life? How is work? How's family? How's a relationship? I hope everything is going well. And if it's not, listen, bestie, you're going to figure it out. You have figured it out before and you will figure it out again. The only thing I want you to remember is never ever give up on yourself. You are your worst enemy and only take opinions and criticism from yourself. Okay? I love you, bestie. Everything is going to be all right. And if it's not, ask for help. It is not a weakness to ask for help, which is something that people are having a hard time of because they're like, if I ask for help, it shows that I am weak and I'm not capable of doing anything. But actually, asking for help is a sign of strength because you know when you actually need help and you cannot do it alone. And that's totally fine because you cannot carry the whole world in your back, bestie. Okay? I love you so much. How are you? I miss you guys so much. Well, something about me, I am very busy in the sense that I just actually signed a contract for a nursing job that I talked about you guys last episode. And I am so happy to be back working again as a nurse. And this is a different nursing job. You're going to be surprised what I took up for myself. And again, I was in therapy since December. I quit the hospital in December. And I have been in therapy for my burnout and my depression and my anxiety. And everything is working well. And now is the time for me to go back working again. That's why I was so happy looking for a nursing job because I cannot not work. It's just, there are days where I'm just lying down in my bed. But now is the time that I feel 125% ready to go back working again. My cup is full. Now I can pour some love, some dedication, some energy to somebody else because my cup is overloaded of love, of self-love. Okay, and I can share that to somebody else. And I just want to show you guys, I don't know if you're seeing it, but this is my merch. This little crew neck, it says shift happens, caffeine helps. You know how like shit happens? Shift happens, caffeine help. And also I'm holding this cute little Stanley dupe cup. It says we'll continue to monitor hydration in a very, very small cap. And this is also my merch releasing very, very soon, you guys. Or actually maybe it's releasing this time now. Yeah. So that's a little update in my life. And also, I have been seeing a lot of my friends from nursing. We have been chilling outside. We have been trauma dumping on each other. And yep, that's basically it. And for today's episode, before we even start, I just want to ask you a favor. If you're listening right now, please make sure to download this episode, leave us a 5-star, share this episode, and make sure you listen to the other episodes and download it too. Follow the podcast, turn on notification. This will help our podcast to be on the chart so that general public can listen to this and know what we're going through in healthcare and your stories, and so that you don't feel alone and other people who's gone through the same situation as you feel that they're not the only one going through it and that there is someone out there who they can relate to. Okay? I love you. Okay, so today's episode is all about miracle in plain sight. So one thing about me is that I'm religious, but I'm not very religious. Let me explain this. I grew up Catholic. I grew up going to church. I grew up celebrating like feast days of the saints because that's how it is in the Philippines. And I wasn't forced to be religious. I just love and know that there is a higher one up there who is my creator, Jesus Christ. And I do believe in him and his love and that I was brought to this world because he has a purpose for me and for my life. And I think one of the purpose that for me to serve, what he has given me is this, being able to share my story, being able to help other people and the nursing part. I think this is my goal in life. And I'm so happy. Since we're talking about miracle in plain sight, again, these are all real stories and there are going to be stories about miracle and people believing in God, in Jesus Christ, and prayers and stuff like that. And I do understand that not all of us are religious and not all of us believe in him. And I am not forcing you to believe in that, but I also want you to know and respect people who have beliefs, people who believe in Jesus Christ and God. Again, this is a very safe space for all of us to connect and to understand that we all have our differences, and differences is okay. You don't have to agree to someone, you don't have to agree with me. All you have to do is know that we all deserve respect and understanding. And this is again Miracle in Plain Sight episode. I beg your pardon. Are you guys ready? Okay, let me just drink my water because I've been forgetting to drink water, and you probably are too, bestie. Those kidneys are screaming again. They're like, we're pretty dehydrated. Water is so good. So another thing too is, guys, like I drink a lot of coffee, but this past few weeks, I've been noticing that I have been getting all the crash because I have not been drinking as much as I do with coffee, because I usually drink like 3-4 cups of coffee. That's really a lot. Now I'm like resorted to just one or not even one, and my body's like craving and looking for it, which is okay, I guess, because, you know, as a nurse, that's the only thing that's keeping you alive. But I'm trying to cleanse my body with just water. Yeah, just a little something. Alrighty. Are you guys ready for our first story? Let us do this. So again, this is a tell me a miracle you've experienced, have seen while working in healthcare, or anyone that you know who you've heard had experienced a miracle. And miracle comes in different forms, okay? Hey, so I was working in ICU and we had a man come in who had the tire exploded in his face, causing massive internal injury and brain swelling. He had 2 blown pupils. Oh my God. We thought he was gone. The doctors decided last minute to take him to OT to evaluate the bleeding to give him one last chance. And amazingly, they did that and he came back from theater and woke up. He came back to visit ICU 6 months later and walked in to thank us all. One of the most amazing things I have ever seen. Yeah. So the thing about working in the hospital, or, you know, working as a healthcare professional, you've seen many different cases that sometimes you could already tell that person is not going to make it. That person is going to go through a lot of suffering and pain. But then the most amazing part and the miraculous thing is, you've seen the worst things that happen to that person, like from all the machines, medication, tests, surgeries they've been through, and they still get back up. And I think that's really amazing, and it makes you feel good if you are part of the people who have helped this man get back on his feet. And I've experienced that many times where I worked before in the med-surg transplant floor that I worked at, and it makes me happy when they come back with a smile on their face, on their feet, walking, have their strength back again, and they come to you and tell every single one of you, thank you for being part of my second life. And it makes a difference. That's like, I think, the proudest moment to a lot of us nurses and even doctors, OT, nutritionists, everyone, even the pharmacists, that, oh my God, I've seen this man face to face with death, but now he is now alive again and enjoying life. That is amazing. I love that. I love that story. Next. Hi, loving the podcast so much. Thank you so much. I work as a kidney dialysis nurse for the last 3 years. It was really an amazing experience and something I will always be thankful for. I remember one day, my charge nurse let me call a patient and let them know that they had regained full kidney function and that they would no longer need dialysis. It was such an amazing moment, and months later, the patient came back to our clinic to thank us for caring for him. Many of my patients died and a few were able to have transplant, but that was a miracle I'll never forget. That is so amazing. It's so nice to hear again, because I work in transplant and we've had patients who had kidney transplant, and I've seen patients die waiting for a kidney transplant or post-transplant after they got their kidneys, that things went wrong and they didn't last long. And I've seen patients also who had their kidney transplant, they go through so much pain, suffering, and then after that, they get back on their feet. And it's just amazing to see that, because then you believe again in your profession, you believe again how much difference you can make as a nurse. I don't know how nurses function. Like I said, a lot of us nurses are going through a lot in our life because we have our own personal life too, which is not talked about, because again, when we are at work, our personal life is separate from our work life. Sometimes you cannot avoid that, because if you're going through divorce, fights in marriage, family problems, mental illness, and all that stuff, it's hard to control it. But again, you always have to put this poker face or this smiling face when you're working, because you want to make sure that your patient don't see that because they're already struggling. But I don't know how nurses do it, how we do it, how in all of the things that we're going through ourselves, we're still able to take care of somebody else and prioritize someone else's life over us. That's why I always think, and again, this is my opinion, I think like if you choose to be in healthcare, there is something within you that is good. There is something within you that loves the healing, the caring, the giving back to somebody else, a stranger that you don't know, that you just want to help, that you just want to be part of their life. And again, like some nurses say that they're there for the money, which I don't really think so too, because again, there's no money in nursing unless you travel nurse. You know what I mean? But at the same time, I believe that you're here, you took up this profession because your heart is good, your intentions are good, you want something good for someone else, and that's beautiful, and I want to thank you for that. I think I'm gonna cry in one of these stories because this is crazy. When I was 16, I was diagnosed with osteosarcoma, bone cancer. Since I was considered pediatrics, I had to see an orthopedic for pediatrics. Before I did any type of testing or biopsy, he told me that they were just going to do chemo and amputate my leg. Thankfully, my mother decided that we're not going to settle for that answer and to go get a second opinion. We then went to another hospital and met the best doctor ever. I consider this man to have saved my life. We did a lot of biopsies and found out the tumor was benign and was able to get a total knee replacement. I'm 25 now, and I never thought I was going to be able to do what I wanted to. I see him every year, but during COVID, I had seen him 3 years prior. One of the visits that she did with him, I teared up when he said, "Look at you all grown up." He is also the reason I choose to be in healthcare. So there's a few things I want to talk about this topic. So first of all, again, it's some healthcare workers' opinion that are very strong and they stick to it and they think that's the only solution in a situation, which happened to my grandpa too, because again, the doctor told our family that, hey, you guys should spend your time because he has less than 6 months to live and we don't know when he's close to dying. We didn't took that as an answer, but it was just so heavy that from a doctor, that's the only thing he told us. Instead of like, we can do this, this, and this, and we can try these things, and these are the pros and cons of it, you know, like give us option instead of like focusing in one thing only. But then back in the Philippines, if you offer them money, they would do more things. They would probably go to an extent that you're never going to imagine. But if you don't have money, there's only one solution to something. And I'm so happy that your mom did not take that one doctor's opinion and answer, because if they did, then your life wouldn't be the same right now. And I am so happy and I hope you are in remission. I'm just so proud of you for going through all of this and for trusting your gut, and you have an amazing mom, and that doctor did save your life. It's so funny too, because I saw this article in a Washington Post, I think, and it was a 75-year-old grandma or 80-year-old grandma, and she's getting married again, and the purse to her husband, so I think they're like silver wedding or golden or I don't know, platinum or something like that. And the person who walked her in the aisle was the two doctors who treated her. And that is so amazing. That is like the sweetest thing ever. And that is so cute. And I feel like this is the situation too. And again, if you choose to be in healthcare because of this person, he should be proud because he did an amazing thing. He gave you another chance in life. I love you. Next. I had a pediatric patient who was liver failure and was starting to slowly decline. Distended abdomen, jaundice, not tolerating feeds, incapable to regulate his insulin. I was a new grad, 6 months in. Patient had a bloody stool and I knew right away we were not in a good place. I told the team we should do a CBC, which is a collection of blood, and send the type and screen. So they're doing type and screen, they're collecting blood to make sure that they can match that blood type. So in case the patient needs a blood transfusion, they already know if it's type A, type B, O positive, O negative, stuff like that. Less than 20 minutes after I sent her labs, the mother called for me that the baby seems uncomfortable. I walk in to see the patient and they look more lethargic with loss of color and they start projectile vomiting blood. Oh my God. Immediately PQ Pediatric ICU. Team arrives and we transfer the patient post 3 more large MSs. Till this day, the scariest shift of my life. About 6 months later, I saw the mother and didn't recognize the patient. Liver transplanted and just started taking her first step. The mom immediately recognized me and thanked me for saving her child life. It was the best moment of my career. This is so beautiful. I think like this is the things that we can tell our grandkids, or when you're out there and you need to brag about something that you've done in your life that made you proud of who you are and what you do. This is the type of thing that you should be happy about. So actually, guys, let me tell you a story of one of my patients. We will name this patient Mrs. Smith. To keep it confidential, we will name her Mrs. Smith. So she is a patient of mine that was admitted for a cancer somewhere in her throat or larynx, but she was basically on her 60s or 70s. Her husband already passed away and she has a daughter, and her daughter is married to this Latino guy, and they have 2 little cute kids. They always go on vacation to, I think, Colombia or where the dad lives. And then she was showing me all this picture, and I had her as a patient, and she was really the type to not talk. And again, she's unable to talk because she has a large mass on her neck. But then sometimes when phlegms are out, when everything is clear out, she's still able to like speak. And she's going through chemotherapy, and she even had a stoma. There's a lot of things going on with her, so she wasn't doing very well. Anyway, so I had her as a patient. Our first ever interaction, I guess, wasn't good because she doesn't really want anyone going in her room, and she refused to. And of course, my jolly self will try my best to follow her and do things for her so that I can get her trust and we can build like a relationship. Because again, I am your nurse, I am your provider. It is my job to get to know you. It is my job to know who I'm giving my service for. And again, that's just a part of me that always loves doing that. Anyway, she's been in a hospital for I think 2-3 months because she's going through chemotherapy. She got C. diff, she got infection, and she needed to go to a lot of tests. It was really tough seeing her because then she would do better, everything would be okay, and then she's gonna have the downfall, and then I'm gonna come back and see her. I would just sit down with her, and there's this one point where she was about to go home. It was really sweet because I've been taking care of her on those 2 months most of the time. And the thing is, she was supposed to go home the next day, and I was working on that shift, and I'm not with her. I'm in another pod. And then the nurse who was taking care of her went to come see me and asked me if I can come to her room because she's asking for me. So I was like, okay, what's going on? What's happening? So I came to see her. She was sitting on the reclining chair. She looks so good. She doesn't have hair because she's going through chemotherapy, but she's all smiling. She is reading on her iPad. And then she showed me the pictures of her grandkids and her daughter and her husband. And then when I was sitting with her, she's like, John, thank you so much for taking care of me, for listening to me, for being the only one who did not lose patience while I was suffering. And I completely told her, I was like, look, I understand that it's not pleasant to be in the hospital. I would feel the same if I was in your position. And it's just overwhelming, like all in all. And I completely understand you. I told her I cannot lose my patience on you because you remind me a lot of my grandpa. And then so I sat down with her and she told me like, John, can you give me like your address? Which I told her I can't because we're professional. I cannot do that. She's like, I just want to send you like a little something because I felt like you were my grandson and you really touched my life. You made a difference in my life. You encouraged me so much during the days that I feel like I just want to end it all. And we're crying. I hate crying, you guys. But so she was so happy. She's like, I would never forget you. You made such a difference in my life that she's like, I think even in death, like you'll always be a big part of my life. And the sad thing is like, okay, you know what? Tomorrow it's my off day. But then there were missing nurses the next day. So I was like, you know what?
wait, let me take an overtime shift, but my only request is that can you please put me with her so I can send her back home myself. And so the nurse in charge was like, absolutely sure, no problem, as long as you take the shift. And I was so happy. And I know that she likes lavender, like the plant, like lavender. So then I was so excited to go in my shift. It was an evening shift from 3 p.m. to like midnight. So I made sure to drive to like my supermarket to get her a lavender plant. And so I come in with my lavender plant to come see her. And I was like, wait, why is everything, why are you guys packing her things up? Like, where is my patient? Like, she's supposed to go home, right? And they told me that she died. Apparently, she was in distress around like 2 or 3 a.m. in the morning. And she was calling my name. And I still remember it really fresh because I was like, oh my God, I'm going to be able to bring her home after those. Like, she just wanted to see her grandchildren again, to be able to dance with them. And she even made this little like puppet thing for the 2 kids because she's like, I'm going to be able to finally see them again. But then something happened and she just passed away. And I don't know how she did it, but she left me a note. The note has a message. And it was just really hard to see that because I thought that was another like miracle that finally, like after all those, she was palliative anyways. But it was just, I was so happy that I was able to bring her home again, you know, like, because I promised her, I was like, we're going to get home no matter how much infection she gets. I was like, don't lose hope. It's okay. I'm here. I even brush her hair, do things for her. But this is one thing I hate. I don't like about nursing is that I get too attached to my patient because it's just hard for me to see people suffer. Okay, guys. We're back. Let's do this, you guys. Sorry about that. Hello, Nurse Sean. I can't express how much I love you and admire your work. Once I was working as a student nurse in an intensive care unit and I saw this beautiful young man in his 20s who walked in with goodies and treats to give to the nursing staff. He hugged each and every one of them and thanked them for saving his life. He was in a coma for 12 weeks after a severe car accident and he wasn't expected to live. According to the doctor's prognosis, he said that while he was in a coma, he could literally hear everything and every nurses who has encouraged him to not give up. He is a living miracle. That's amazing. That's why I said, like, when patients are in coma, that doesn't mean that they're brain dead or like they cannot know or feel or hear what you're doing or what you're saying. They do. That's why we tell families like, hey, even though you don't see him opening his eyes, you don't see him talking, he's intubated and whatnot, but talk to him, talk to her. Because they can hear you. They're there. They're listening to your encouragement, your love. This is beautiful. This is a beautiful story. And I love that. I love that. I really think that prayers too move mountain. Because with that patient that I was just talking about, like I prayed with her. We prayed together. We were praying the rosary together. And like it brought us to that point where she was doing great. And it's just so happened that unexpected things happened, and I guess that was her time to go, and she had passed away. Next, I'm a registered veterinary nurse / technician, and believe it or not, a lot of the things in human medicine are the same in veterinary medicine. We have to have the same compassion, deal with the same bullshit, deal with the same Karens. The worst thing about our field is workplace toxicity and the people not remembering why we're there. What gets me through is seeing my patient walk out knowing I did the best I could do that day. That and foreign body surgeries, the crazy X-lap was a coon hound that came in May for being pale on and off. Turned out she had a partially torn spleen after falling down the stairs. We ended up removing her spleen as there was necrosis. But 6 months after that surgery, she comes in for a foreign body surgery. Turns out she ate a small cake topper back in May, possible additional cause for partial torn spleen, but I just wanted to reach out and say thank you for your amazing content. Oh, that is amazing. Oh, poor baby. That's why my dog is, sometimes I don't even know like what they're chewing because they would literally chew my shoes and I don't know where the piece that they chew Did they swallow it? Did they shit it? I don't know. And thank you for all the veterinary nurses, veterinary doctors, technician, assistants. Thank you for saving our pets' lives. And listen, this pets is what we go home to, and we're so happy to see them because they are our joy. They are our kids. They're the one who's always there, even on the baddest and the shittiest mood I've ever had, and they're just sitting there waiting for you to cuddle them, to kiss them on their tummy or like pet them. Thank you guys so much for keeping them alive, for keeping them healthy, for helping us. I have seen a miracle. I was posted in ICU that time. One 20-year-old guy, known case of hypertrophic cardiomyopathy. It's a condition where all the chambers of the heart are bigger size and requires much more pressure to pump out the blood. Such patients go into sudden cardiac arrest due to abnormal heart rhythm. So this guy arrived to the hospital emergency in cardiac arrest with completely flat line. No signs of life at all. We have CPR for almost an hour, push drugs, and when spontaneous circulation returned, we have him induce hypothermia, means lowering body temperature artificially to reduce body metabolism. For 40 days, he struggled for life. Multiple infection, multiple procedures, slow neurological recovery, bed sores, and surgeries. But I had seen him walk out of that hospital smiling. That was the first miracle of medical science I witnessed. Wow, that is such a beautiful story. Again, me too. I've seen someone come in not in their best shape, and you cannot even recognize them as a person because they're just so sick. And even post-surgery, you cannot recognize them because they're just suffering, and they don't look the same person because they're really edematous, where they swell so much, or they're super thin. And then after the work of all the doctors, the nurses, the physio, the OT, everyone in the team, they regain back to their normal status, normal physical look, and normal health. And you just become so much more proud of yourself. And again, that's, I think, one of the reasons why I burn out too, is because whenever I'm able to discharge a patient, when I'm able to bring a patient back to normal life, it pushes me to work even harder, to keep going to work, to do more, to take overtime shift, because I was like, hey, if I can do this to another person, I can save another life. I can get someone else out of the hospital too, which I shouldn't have done because I burned out. But again, it's just the type of person I am before, not anymore. I mean, I'm not saying that I don't care about people anymore, but it's just that I know my boundaries now compared to before. That's what I mean. Okay, I was working in A&E. Whilst on my training, I had to deal with really intense RTC. A young man had crashed into a tree doing over 100 miles per hour. Wear your seatbelts, please. I'm telling you guys now, we have seen so many cases of car crash, and things could have been less worse if people are wearing their seatbelt, if they're not on their phone, if they're focused on driving, if they're not drunk, please. The chances of him surviving were very, very slim. He's broken nearly every bone in his body and damaged his left leg so severely from his ankle right up to his femur. They told him he wouldn't walk again. He spent months in hospital with me, and I stayed on the ward with him. Once 80% recovered, he was told he wouldn't walk again. I spent months in the hospital with him, feeding, dressing, reading, and sometimes singing him to sleep. That is really sweet. I helped him when it came to adjusting to life in a wheelchair, but always told him that I thought he would overcome his injury. God told me that he would walk again. I could just feel it in my bones. I spent hours and hours with him after he requested I help him during his physio sessions. I used to come in on my days off to assist him with anything he needed as long as it aided his recovery and, most importantly, improved not only his mental but his physical health. After 18 months, he was discharged. He left the hospital in a wheelchair, but before he left, I told him to never give up, to never let what happened to him define him as a person, because miracles really do happen. I told him I would always have faith and believe that no matter where he was in the world, he was doing his absolute best and would beat whatever fear was holding him back. I graduated from med school. Not long after that, encountering and during my graduation, he presented me my degree. He walked across the stage and handed it to me. In that very moment, me choosing healthcare as my profession has never made more sense. Wow. Oh my God. Wow, this is an amazing story. And again, do you guys see how much effort healthcare workers put to help other people? And she's a medical student. She's probably a doctor now. Thank you so much. And every single patient that you will have or you have had are lucky to have you as their doctor. You are amazing. Thank you for your compassion. Thank you for being a human being. Thank you for understanding someone. Thank you for being there for someone on their worst and on their best. And I just want to say how some healthcare workers will go to more than their boundaries, an extra length to help someone, to get someone feel better, because nothing feels better when you're able to make a difference in someone's life, when you're able to bring someone back to their feet. That's basically it. And this is so sweet because he handed you your diploma. That is so sweet. I hope you guys are friends out of like the profession, and he must have been so lucky, and he must probably bragging about you to all of his friends, to anyone he sees, because you literally saved this man's life. Thank you again. Thank you, doctor. Next story. My extraordinary story that made an impact on me was the time I quoted an elderly man in his late 80s a few years ago. He was so sweet, made dad jokes all the time, and was always thankful to us nurses for looking after him, even when he felt like he was nuisance. One morning, I went in to check his vital signs, which were all in range, and we were talking like normal. One of my other colleagues asked me for a quick hand with their patient, in which I said to this man, "I'll be back in 2 seconds." When I came back, it would have literally been 3 minutes later, I noticed he was unresponsive. His skin tone had gone grayish. This man was still for full resuscitation, and I coded him right away. Whilst I was doing chest compression on him, we managed to bring him back to life again. Once he had recovered a bit, he said to me, "What happened? I heard a lot of voice," in which I replied and told him he had left us for a bit. His family came in an hour later. Towards the end of my shift, this elderly man called me and said to me, "Thank you for letting me see my family one last time." As he held my hand, I at first didn't take notice of him saying one last time, and found out later that day, after getting home, he passed away. It has always left an imprint on my mind to this day, and feel so emotionally grateful that I could provide this family a last chance to say their goodbyes without knowing it at that time. So this is, I guess, is the very, very muchly same situation as the story that I just told about my patient. And I've noticed that too. Some people really do wait to see someone, to have that special moment that they want before they go. Just like my grandpa, he waited for my birthday, greeted me happy birthday, even though he was already severe with his Alzheimer's, but he remembered my birthday and my name. And 2 days after, he passed away. And I've had many patients who was waiting for their son, their daughter, their wife from a different country, from a different place to come in. And once that person they were waiting for arrive, they leave. And that for me is just like, I see that as a miracle. Like how, of all the suffering, of all the pain that they're going through, they held so tightly until they see that person that they want to, and then let go. Wow. And thank you. Thank you for making a difference in this man's life. I know he's watching over you, and he is so happy that you gave him that chance to be able to say goodbye to his family. Wow. Next. I used to work as a pharmacy assistant. One time we were close to closing, and a couple came in with their baby who had urinary infection. The baby was under 12 months old, so leaving the infection untreated even for a short time was fatal. The medicine needed by the prescription needed to be compounded, but the compound pharmacist had already left. One of our other pharmacists said that they'll try to help out, as the mother was begging and sobbing to help her infant. Ended up being able to give her the medicine that she needed that night, and they continued to come back. The little baby is now a toddler, and I can't imagine what would have happened if we weren't able to give the child's medicine that night. Oh, that is so cute. Thank you guys so much for taking the time, the effort, the energy to actually accommodate someone who's going through a difficult time. And I understand this. I know there's this ongoing joke where, like, you know, once I'm done in my shift, once it's like 7:30 or like it's a minute before you finish your shift, you're not gonna do anything else because that's your I respect that very muchly, because that is your boundaries, that you're not supposed to like do more things. You know what I mean? Because again, if you keep doing that, you're gonna get abused at work, and people are gonna mistreat you and the management and whatnot, and they're gonna think that you're okay staying longer and whatnot. But if it's about like, let's say it's just a patient who's asking for a quick pain medication, but it was your patient and you could have given it, just give it. Because again, the whole report situation where they have to wait 30 to 45 minutes, it's hard to be in a pain situation. And even though it was ice chips and that's the only thing that they can take, because they cannot take any liquid, but they can already put something in their mouth so that they can wet their throat, you're helping someone feel better. Again, just do this in your own thing and just make it known that you're not here to do this every single time. But, you know, like a little action, a little intervention towards someone who needs help can make a lot of difference. And just like this situation, like that baby could have died if they didn't like went further and be like, hey, let's try to make this medication and give it to this baby because this baby is in a critical condition. And now the baby is a toddler. When you meet that baby at one point, when that baby's a teenager or an adult, you can be like, you're alive right now because I was the pharmacist who helped compound that medication that you needed on that time that where you're between death, like living and death. You know what I mean? Okay. Our last submission here. Night shift in the ER, drunk driver lost control and hit the center of the divider, not wearing her seatbelt, ejected from the vehicle. She came to our ER in a cardiac arrest. She had 2 IDs in her purse, her best friend and hers. Similar looking girls. Long story short, both sets of parents were called to identify this girl. Mind you, she was bleeding out. We were on the 6th blood transfusion and probably the 4th code. The first set of parents called us and said that they found their daughter at another friend's house. We ended up coding this 22-year-old 2 more times till her family finally arrived. They gathered around her on the bed. She's now unrecognizable due to the facial fractures, bleeding, tubes, and etc. But as soon as they laid their hands on her, especially her mom, she took a deep breath and let go. I swear, there was something, a whoosh that left the room upward. It was devastating and beautiful at the same time. She waited till her family arrived to identify her and say their goodbyes. That was heavy. But like I said, that's really crazy because there are really people who does wait until the person that they're meaning to see before they go comes so that they can say their goodbyes. And I've seen this many, many times. Like I said, this episode is all about miracles and how prayers can move mountains and beliefs and fate. And I've done it for all of my patients. All of my patients, some of them are not a believer, some of them are believers. And like I said, like this is not something for me to like, I'm not pushing you religion or to believe on something. But for me, I always pray for my patient. Anyone that I have encountered, I always pray for them and ask God that they help them through all this suffering, through all this struggle, and whatever they are meant for them to happen, let it be, type of thing. And I hope you guys have learned a lot of these stories, and there's so many more stories, and I think like we can talk about more because actually I have so many submissions from you guys, and it's just so nice to talk about these positive things and miracle. And I know some of them are not really positive, it's more like sad or negative, but then it's nice to listen to this kind of stories just to like show you guys, to the people who's listening right now who's not in healthcare, that healthcare workers, we do our best and we always do things for the good of others. And again, I'm not talking for every single healthcare workers, but I also don't want people to see that every healthcare worker is bad. Or if they experience something bad from a past experience from a healthcare worker, doesn't mean that every single nurses are bad or every single doctor is bad. There are good nurses, there are bad nurses, there are good doctors, there are bad doctors, and it always exists everywhere in the world. Like not everyone can be good, but when you get the good ones, thank them, appreciate them. And for the bad ones, we still don't know what they're going through. We still don't know what's happening, why they act the way they act, but it's not acceptable. But at the same time, you cannot use that and think that every single other healthcare professionals are going to be like them. You cannot compare all apples and think that they all taste the same type of thing.
You know what I mean? I don't know if I'm making sense in here, but I just want to say thank you to every single healthcare workers who work tirelessly every single day to make a difference in someone's life. You guys have put so much energy, time, dedication, compassion to bring a stranger back to life and bring them home to their families. And I hope you realize that even though this whole system doesn't appreciate what we do, at least we can be proud of the things that we're doing for the people that actually do matter over this job, over the government, over the CEOs, over the hospital. We do what we do because we care about the patient. And it just sucks that we're not being taken care of as much as how we take care of our patient. But we're going to keep fighting. We're going to keep pushing until we get what we need. Safety, respect, and our values. What we deserve. So again, thank you guys so much for listening to this episode. And I know you guys might cry, you guys might laugh, you guys might be shocked, you guys might be moved. And I think this is the reason why I made this podcast, so that we can all relate together. Do me a huge favor, please. Make sure you download this episode, share it, leave us a 5-star, follow us in the podcast, and make sure you turn on notifications so you can get a weekly update when we release our episode every single Friday. Thank you so much, and I will see you again next week. Oh, actually, before all of that, I always end the podcast now with a quotation. Here is our quotation for this episode. Believe it or not, there isn't a single person you need in this life more than yourself. So put her or him first. Remember that. Because I know this stories is gonna make you feel good and want to do more because of all of this miracle and moving stories. But again, I want you to remember that even though you're helping a lot of lives, don't let the management, the CEO, the hospital, the government make you feel like you're a superhero, that you can do anything and everything, and that you don't have boundaries. Set your boundaries. Make sure you prioritize yourself over this job, because again, you are very replaceable. You are replaceable in a second. But the damage you make to your physical, mental, and emotional health takes time for you to heal those. So make sure you put yourself first over anything, because you cannot give love, compassion, and everything else to someone else if you don't have it for yourself. Love yourself first so that you can love others. I love you. I love you. I love you so much. And I will see you next week. Mwah.